Hello, my name is Jennifer Williams. This is a presentation for my Business and Professional Communications class, 1321, Professor DeBoer. Today I'm going to talk to you about post-traumatic stress disorder and the effect that this disorder can have on children and adolescents. As a part of this presentation, I'm going to inform you what PTSD is, what can cause PTSD, and the treatment options. People hear about it, but do you know what it is exactly? Do you understand the effects that this disorder can have on a child? I would like to inform you all about the disorder and what it can do to a person. PTSD is a psychiatric disorder that can occur following the experience or witnessing of life-threatening events such as natural disasters. People who suffer from PTSD often relive the experience through nightmares and flashbacks. They have difficulty sleeping and feel detached or estranged. These symptoms can be severe enough and last long enough to significantly impair the person's daily life. In children, there are a number of traumatic events that have been shown to cause PTSD. Children and adolescents may be diagnosed with PTSD if they have survived natural and man-made disasters such as floods, violent crimes such as kidnapping, rape, or the murder of a parent. Child Protection Services in the United States receive approximately 3 million referrals each year, representing 5.5 million children. These figures may only represent a portion of the child maltreatment cases that occur, but researchers estimated that 2/3 of the maltreatment cases are unreported. These are 3 factors that have been shown to increase the likelihood that children will develop PTSD. These factors include severity of the traumatic event, parental reaction to the traumatic event, or physical proximity to the traumatic event. There are several other factors that affect the occurrence and severity of PTSD. Research suggests that interpersonal traumas, such as rape and assault, are more likely to result in PTSD than any other type of trauma. In terms of gender, several studies suggest that girls are more likely than boys to develop PTSD. There is less clarity in defining connecting PTSD with ethnicity and age, while some studies find that minorities report higher levels of PTSD symptoms. Researchers have shown that this is due to other factors such as differences in levels of exposure. It is not clear how a child's age at the time of exposure to a traumatic event affects the occurrence of severity of PTSD. While some studies find a relationship, others do not. Differences that do not occur may be due to the differences in the way PTSD is expressed in the children and adolescents, or of the different age differences or developmental levels. Now, when it comes to elementary school age children, they may not experience visual flashbacks or amnesia for aspects of trauma. However, they do experience time skew and omen formation. Time skew is basically referring to a child mix-sequencing trauma-related events when recalling the memory. Omen formation is a child belief that there were warning signs that predicted the trauma. As a result, children often believe that if they are alert enough, they will recognize warning signs and avoid future traumas. As discussed above, children may engage in traumatic play following a trauma. Adolescents are more likely to engage in a traumatic reenactment, in which they incorporate aspects of the trauma into their daily lives. In addition, adolescents are more likely than younger children to exhibit impulsive and aggressive behavior. Although some children show a natural remission in PTSD, a significant number of children continue to exhibit symptoms for years if untreated. Several types of therapy have been suggested for PTSD in children and adolescents. Research shows that cognitive behavioral treatment is the most effective approach for treating children. This treatment generally includes the child directly discussing the traumatic event exposure anxiety management techniques such as relaxation and assertiveness, correction of inaccurate or distorted trauma-related thoughts. Play therapy can also be used to treat young children with PTSD who are not able to deal with the trauma more directly. Drugs have also been prescribed for some children with PTSD. However, due to the lack of research in this area, it is too early to evaluate the effectiveness of medication therapy. Specialized interventions may also be necessary for children exhibiting particular problematic symptoms or behaviors, such as inappropriate sexual behaviors, extreme behavioral problems, or substance abuse. In closing, I would like to say that PTSD is a challenging disorder, especially in our children, and it isn't a simple process to recover, but with different treatment options and medication, there is promising, and learning to cope and recover can lead to somewhat a normal life. It is my hope today that the information that I have provided will help someone that is or knows someone that is dealing with PTSD. Thank you.